Good afternoon, everybody. My name is Jason Fritz. I'm on the Division of Epidemiology and Emergency Preparedness with Williamson County and City's Health District. That is our local health department here in Williamson County. And today I wanted to jump on and talk to you guys about how to help prevent the spread of COVID-19 at home. With back to school coming up and all of that, there's, a lot of questions and uncertainties, but I want to try to help provide some information that can, help you make the right decisions going forward. So today what we want to talk about is, what exactly is COVID-19? We hear about it on the news constantly, but we all know exactly what it is. Talk about symptoms associated with this disease, how you get infected, and ultimately ways to help prevent it. And then at the end of the slideshow, I will provide some helpful links to some credible resources on where to go get information. That way it starts you out on the right track. So what is COVID-19? It's fairly new. It's a novel virus, meaning that, it's brand new. It, was just found last year. It's still fresh. The virus itself is called SARS-CoV-2. And basically what that means is the virus is SARS for severe acute respiratory syndrome. CoV is coronavirus, and then 19 for 2019, the year it was found. It was discovered in China in late 2019, associated with wet markets. We haven't found the exact origin yet, but it is highly believed that it began in an animal and then had what we call spillover into humans. Over time, it has made its mark worldwide and is the responsible agent for our current pandemic that we're undergoing right now. So we look at symptoms. Symptoms. When this first started, they were very, straight and to the point. It was fever, cough, and shortness of breath. But as this virus has evolved over time, and as we begin to learn more about it, we are seeing that there are more than just those routine symptoms. And in some people, they may have no symptoms at all. So they can be very, very mild, where you feel totally fine, but you do have coronavirus and you're infected. And the other side of that spectrum is people that have severe respiratory symptoms that develop into pneumonia and can be fatal. So generally, if you're going to get symptoms, they will occur between that 2 to 14 day period after you've been exposed. That's what's known as the incubation period of the virus. So anytime someone is asked to quarantine after they've been exposed, we want to make sure that you quarantine for 14 days because that's that time frame that if you're going to get sick, it should be within that 2 to 14 day window. And of course, just like many other viruses, older adults and those with weak immune systems do have an increased chance of developing those more serious symptoms, just because their body's immune system can't fight this stuff off. And that goes for many viruses, not just COVID-19. But diving into the symptoms a little bit more, like we talked about earlier, fever, cough, shortness of breath were kind of the initial symptoms that we heard of. But over time, we're starting to see people with body aches, muscle aches, gastrointestinal symptoms such as vomiting, diarrhea, and then, of course, the interesting symptom of that new loss of taste or smell. So some people have only had that. There's multiple, different options of symptoms that you may develop with COVID-19. But again, like we talked about earlier, generally it's within that 2 to 14 day window of exposure. But how do you catch it? That's something that, everyone is worried about. It's not a virus that just jumps out and grabs you. It doesn't just come in through your window and find you. It is something you have to catch. Most commonly, it's person-to-person transmission, meaning that, person A gives it to person B. And the usual route of transmission for this virus is through what we call respiratory droplets. And essentially what that is, as shown here, when you sneeze, cough, things like that, you do emit or expel respiratory droplets out into the air. What can happen is virus particles can be within those respiratory droplets and then linger. And normally without a high-speed camera, you would see the mist that comes out of someone when they sneeze. But those particles hang out in the airspace, you walk by, breathe those in, and then that's how that virus can get into your upper respiratory tract. Unfortunately, people can spread COVID-19 without showing any symptoms, and the reason for that is even when you talk, when you sing, when you yell, you can still emit those respiratory droplets. But the other kicker with that is, contaminated objects. You go where you sneeze, you wipe your hands, and then you prepare a meal. Picking up something contaminated from a surface is another way to get exposed. You touch something that's dirty, you touch your nose, your mouth, your eyes, something like that, where that virus found an entry point into your body. So those are the most common ways to catch it. At this time, we have not seen where an animal, especially a domestic animal, dog or cat, has transmitted COVID-19 to a human. There have been a few cases of animals getting COVID-19, but that's something we're still learning about and still trying to determine if that's something that can be passed back and forth. But at this point in time, presently, that's not an issue of getting COVID from your dog or cat. Prevention, that's something also very important and kind of the big takeaway from this presentation. Preventing COVID-19 is not much different than preventing other illnesses, especially for respiratory diseases. A lot of our messaging around flu season is very similar to this, and then we've just kind of expanded that and made it a year-long discussion from this past flu season all the way coming into the next flu season this fall. These basic preventative measures to keep yourself from getting sick. With COVID-19 not having a treatment yet that's universally recognized, I wanted to share that quote from Benjamin Franklin about an ounce of prevention being more than a pound of cure. The more we can prevent this disease, the more we can help continue to flatten that curve as we've been doing. So in no particular order, here is a list of some of those preventative measures. I've got some infographics from CDC to kind of follow up with that you can get online, and certainly share those with your children. Pictures are always a good way to get that message across, where they don't have to read a document or a paper to say, oh, here's what I need to do. Just look at this picture. But obviously, Public Health 101, hand washing is super important. Not just to prevent COVID-19, but many illnesses. Anything you can get under your hands, washing them off is going to help minimize that. We talk about social distancing, maintaining that 6-foot distance, because as we saw earlier, the gentleman with the respiratory droplets, you want to keep your distance from that. You don't want to be in the spray zone or something like that. But of course, covering your coughs and sneezes. There's still a lot of talk about face masks. They are working, they're helping. So continuing to wear those, especially when you're out in public. As always, staying home when you're sick, that's going to help you get better. You can stay home and rest and recover, but also it keeps you from going to work and exposing your coworkers, other family, if you go to visit them, things like that could get them sick. Trying to not touch your face, that can be hard, especially when it's hot in the summertime. You constantly find yourself wiping your face because you're sweating or readjusting your mask, things like that. But making sure your hands are clean before you do anything like that. And then earlier we talked about contaminated objects that could be contaminated with the virus. Making sure that we're cleaning and disinfecting normally with an appropriate cleaner. So kind of within the home aspect, I just wanted to share these infographics with you all and see what we can glean from them. But of course, like we talked about, cleaning and disinfecting, the big takeaway that I always want to tell people about that is you want to clean a surface before you disinfect it. You don't just want to spray Clorox or any other cleaning agents on there. You want to wipe the surface down first. That way when you do disinfect it, you're disinfecting the actual surface and not all of the particles or junk that are on top of it that you're going to wipe off into the trash. So make sure you're using that, and then following the labels on any cleaning supplies, being very cognizant not to mix certain things, because certain cleaning agents when mixed can be toxic. So you want to make sure that you're paying close attention to that and just following the label. Everything has labels on how to do it, how long it needs to sit, and etc. We talked earlier about social distancing, maintaining that 6 feet. I know this is something that can be difficult to do at home with your family. This is one of those things that, you and your family are all around each other all the time. So, the only time you really want to focus on social distancing at home is if someone at the house is sick. You want to try to avoid them, if able. Obviously, if you have someone that needs direct care, you're going to need to be near them. But just as they are in the picture trying to wear a mask, it's just another barrier of protection. There's no such thing as too much protection. especially when we're talking about a pandemic illness like this. Of course, covering your cough and sneeze, trying to avoid being like the gentleman earlier and just sneezing, flat out into the open. When you cover that with a cough or sneeze, it does decrease those amount of respiratory droplets that are coming out. And then getting into the trash, not leaving it to contaminate an object where mom or dad may go pick it up and, then go touch their face and find themselves sick. So making sure that we're, maintaining that cleanliness and organization there. Like we talked about again earlier, making sure that you're staying home when you're sick, or in some cases when you've been exposed. If you've been exposed to someone with COVID-19, if you get a call from your health department or from a friend that says, hey, I tested positive and we were around each other, trying to stay home as best you can to monitor for those symptoms that we discussed earlier. That way, if you do develop them, you can go get tested or see your medical provider to get the proper care that you need, but also try to avoid being around others and continuing, the spread of disease. That's going to be one of the most important things as we continue to, navigate through this pandemic, making sure that, if you're exposed, you stay home. If you're sick, you stay home. Those are the big things. If you're not out exposing people, in turn, it should help prevent illness. Again, as we talked about earlier, always keeping your hands clean, but not avoiding touching your nose, eyes, and mouth. Those are very simple and easy routes of entry for many viruses. So you want to avoid that. Again, not just for COVID, but many respiratory diseases. And of course, hand washing, I can't stress this one enough. A lot of times in the absence of soap and water, people use hand sanitizer. You want to make sure you're using 60% alcohol-based hand sanitizer, but that doesn't act as a substitute for hand washing. You still want to try to, after you hand sanitize, make sure you get to soap and water and wash those hands and get all those germs off. But making sure you're using that 20-second rule so you can actually get everything. The way I remember is just singing happy birthday to myself twice. You can do the ABCs. There's a bunch of different songs you can look up. Or just sing the first part of one of your favorite songs for about 20 seconds. And then you should be at an adequate amount of time for hand washing. And of course, as we talked about earlier, again, the face masks. When you're at home with mom and dad or the kids, the whole family doesn't wear masks in the house. Unless someone's sick and you're trying to avoid the spread of illness within the house, a mask can certainly help. But when you go out in public, especially places where social distancing cannot be maintained, wearing that mask is not just going to help protect others, but it's going to help protect you as well. So that's something that's very important about that. We are seeing with mandates of masks and things like that throughout the country and within the state of Texas that we are seeing these case counts start to level off. I wouldn't say that they're on decline yet, but they are starting to level. And as a public health professional, I do believe that the face masks are helping with that. So again, it's a minor inconvenience to put a mask on. They're not the most comfortable, but we're not asking you to wear them 24 hours a day. It's something that just whenever you're out, most people are not out, 24 hours a day, but it can be done, and it's just a small inconvenience to help your neighbor from getting sick. I did want to add the do's and don'ts. Children that are under 2 shouldn't have them. And when this infographic was made, they didn't want you using surgical masks and things like that, but that was when we had a shortage. Cloth masks are great because they're reusable, whereas surgical masks are kind of a one and done. You use it and you throw it away. Cloth masks are a lot more long term. Throw them in the washer, they smell great, and you continue to use those over and over again. But also the other big thing is making sure that you're covering your nose. If you're not covering your nose, that's a very easy path for viruses, bacteria, things to get in. So if you're not going to cover your nose, then you do risk illness. It'd be like wearing not a mask at all. So make sure that you're wearing those when you go out. I can't stress that enough. I did want to share those resources. The links are here. There are both federal, state, and local resources. And then that final link at the bottom is a list from CDC about coping at home, whether it be with COVID and the effects of that if you have someone sick in your house, cleaning, a bunch of different things, how to do laundry when someone in the house has COVID. There are all a lot of resources out there. And I want to make sure that y'all have access to those to make sure that you're going to the right place to get that right information. to help keep you and your family safe. And then lastly, I did want to have a shameless plug as overall overseeing the mosquito surveillance program. COVID-19 is not the only virus that's circulating here in Williamson County. We have had a few mosquito pools test positive for West Nile virus, which is spread by mosquitoes. So with the recent rain that we've gotten from Hurricane Hannah that's kind of graced us with the presence, I want to make sure that everyone's practicing our 3Ds to prevent mosquitoes at their home. So make sure we are draining standing water, dressing in long sleeves and pants when you're going outside. That'll help prevent mosquito bites. And then if you do go out, if you go to the park, things like that, especially at dawn and dusk, when mosquitoes are most active, make sure that you're using an insect repellent. Again, these also are not new sciences to help prevent disease. We've used these before and they have worked. But overall, that's kind of the big picture that I wanted to share with everyone today in regards to mainly preventing COVID-19 at home, but utilizing those resources can help make a guided decision. And then should anyone have any questions, don't hesitate to give us a call at your local health department.